Hello, I'm Dr. Jason Lowry. I'm a board certified and fellowship trained orthopedic surgeon here with Arlington Orthopedic Associates. And I wanted to talk a few minutes about total knee replacement utilizing new technology. It is a robotic type system that's called the Robotic Surgical Assist. And it is newer technology that allows us to fine tune how we do knee replacement with the hopes of improving patients' outcomes and satisfaction. And this is a standard total knee replacement. The traditional way of doing the knee replacement is enhanced with a robotic system because we are able to assess and test the patient's ligaments on the side of the knee. And so, for instance, if this is the knee, we check the stability both side to side, front to back, from the knee being completely straight like this, bent 60 degrees and at 90 degrees. That allows us to have a better idea of how uniquely the knee moves in space. They've discovered that over the past 20 years or so, patients' results after knee replacements sometimes aren't as good as we had hoped as surgeons. And the whole idea of the robotic system is to improve how the knee works in space, really focusing on the patient's unique anatomy with their soft tissues on the knee. And what I've discovered by utilizing this technology in the past 7 to 8 years in my practice, my patients definitely are doing better and are happier with their knees. Come see me at our Arlington, Mansfield, and Midlothian locations.